Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi everybody, welcome to Falling Through the Cracks. Today we're welcoming Dr. Darin Ingels. He is a respected leader in natural medicine with more than 26 years experience in the healthcare field. Dr. Ingels has been published extensively and is the author of the Lyme Solution, a 5-part plan to fight the inflammatory autoimmune response and beat Lyme disease. A comprehensive natural approach. It is a comprehensive natural approach to treating Lyme, and we are discussing this today because May is Lyme Awareness Month. So Dr. Ingels, welcome to the show.
Oh, thanks, Rebecca.
So what inspired you to write this book about Lyme?
Well, that was easy. I actually got Lyme disease. So, there's nothing like a little personal experience to give you a very quick education on the disease that you're dealing with. So I actually got infected about 3 weeks before I opened my own practice back in 2002, living in Connecticut. And, I had classic Lyme disease. I had, a headache, a high fever, swollen glands, joint pain, back pain, numbness, tingling, the whole gamut. And I had meningitis when I was in college. I thought I had meningitis again, and as I was on my way to the hospital, someone noticed I had a big bullseye rash on the back of my leg. Of course, it was behind me. I couldn't see it, so I didn't know that's what it was. So once I saw the bullseye rash, I knew what it was Lyme. I knew it was Lyme, and so I went and started on antibiotic therapy. And after 4 days of treatment, I was really perfectly fine. It just so happens, being a new business owner, I was doing everything. So after about 8 months of working very long days, I started to relapse and get symptoms again. I went back on antibiotics and it didn't do anything, and then I changed antibiotics and it didn't do anything. So I went through about 8 or 9 months of changing antibiotic protocols and really it was getting worse. So I was fortunate that I had a couple of patients that had worked with a doctor in New York City named Dr. Zhang. So I went to see him, and he started treating me with Chinese herbal formulas. And really, after about 3 or 4 weeks of treatment, I was about 85% better. So it was really kind of my enlightening moment that there's a lot more to Lyme disease than just trying to kill the bug. And clearly, antibiotics were not doing it for me. So I had to start re-looking at my life and what I was doing, and I realizing I wasn't sleeping well and hadn't been eating well and really just hadn't been taking care of myself. So that was my kick in the pants to, start living a better, healthier life and doing what I've been advising my patients to do. And also realizing that, there was so much more to Lyme, again, than just the infection. And it had really sort of transformed into a much broader, complex medical problem. So I think that's one of the beauty about herbs, and we'll probably talk about that a little bit later, but it really, I think, started addressing a lot of the other issues that Lyme creates beyond just the initial infection. So, having applied what I did for myself then to, the patients I was treating, and now, almost 20 years later and thousands of patients, I've found that, this is I think for a lot of people, a much better approach to treating Lyme because they said, the antibiotics come with, potential risks and side effects, whereas, herbs are generally more gentle on the body. And I just found that this approach was getting people better without, the adverse side effects that antibiotic therapy usually creates. So, that was really the impetus behind writing the book, is I just wanted to have a roadmap that people could follow. And I've worked with so many people around actually the world now that are in areas that aren't necessarily considered endemic for Lyme disease, and they're told they don't have Lyme, you can't have Lyme, and just kind of ridiculous statements. So I wanted a tool that people could pick up, and the book is really written to be a patient guide of, step by step, here's what you do from beginning to end, so that, anybody can pick it up and follow it.
Well, thank you for sharing all of that. As my listeners know, my journey also includes, persistent Lyme. I am symptom-free at the moment and have been for a long time, but there is I think that this is why a lot of us we have to get bitten and get infected to realize that we have to help people. And
it's a tough way to go, but I mean, I can say, as you know, having gone through the experience yourself, it gives you a very interesting perspective, unique perspective on what so many Lyme patients go through, and really over the course of many years of being symptom free and relapsing and going through a lot of the same kind of things. It certainly makes it easier to understand when people tell you about kind of all the crazy things that Lyme can do to your body. And I'm like, yep, I know that, been there, done that. So at some level, it really, I think it helps us connect with our patients a little bit better because, we know what they're going through. We've been through it. And I've also tried, pretty much every therapy out there for Lyme that you've heard of. And so having had experience in that area as well, definitely makes it easier to help people.
Well, and we don't need to go into the politics very much. I actually discussed them last week with Mary Beth Pfeiffer about her book, Lyme, the First Epidemic of Climate Change. And, she talks a lot about the Lyme wars. And, by 2050, we're all going to be in endemic areas. And that's actually not very far from now. So right. Hopefully we can bring this awareness before that happens so people can protect themselves before they get infected. But if they do so happen to get infected by Lyme, hopefully you and I are going to be able to help them, and that's what I want us to talk about in this show.
Yeah, well, I'm sure you're aware, I think, North America as a whole, if you can, at least in the United States, if you live outside of, New England or the central Midwest, Lyme is really kind of downplayed, yet we've got, evidence, even through the CDC that, Lyme's reported in every state. And in fact, you probably saw there was an article that was published last week that showed that, birds were really the main reason that we're spreading these ticks around the country. So this concept that, you live in Arizona, Texas, other parts of North America that, aren't considered endemic for Lyme, it's just not true. These ticks have migrated away from their probably normal habitat. And in fact, in New Jersey, there was an article that came out maybe a month ago showing that we have ticks there that are normally only found in Asia, and they found it in a sheep in New Jersey. And so the fact that we're seeing these ticks go all over the place. And when I was at iLabs last year, they had doctors coming from Africa talking about, Lyme in Africa. And gosh, you would have thought there were ticks out in the middle of the desert. So, it's really a worldwide problem. And I'm sure as you talked about last week, World Health Organization has pointed to climate change as being a big driver of that. But, I think the earlier we can get people diagnosed and treated, the better off we're going to be. So that, it really is about educating healthcare providers that, Lyme is real, it exists, it's a problem. And when you've got these people that have these mysterious, collection of symptoms that you haven't been able to identify, it really should be on the radar that, hey, maybe it's Lyme or some sort of tick-borne infection.
Well, exactly. Now, when you described your story, you had this bullseye rash and all of that. Now, I didn't get a bullseye rash, and it's actually quite rare. Can you just tell us how somebody can know that this is something that they should look into? What symptoms should they have, and how do they go about getting tested?
Well, in terms of the symptoms, the problem with Lyme is that it mimics a lot of other conditions. And we call it the great imitator, the great mimic, and there's upwards of 100 different symptoms associated with Lyme. Ironically, I'm actually one of the few cases I've seen in my own practice, in almost 20 years of practice, that had classic Lyme disease with all of the symptoms you read about in the medical textbooks. I think what happens more often than not is that people get this vague collection of symptoms, but the big red flags for me, outside of, headache and fever and joint pain and numbness and tingling and swollen glands and fever and chills and all that, the symptoms, of course, the bullseye rash, if it does happen, is a telltale sign. There's no other, organism that causes that kind of rash. Now, we also know that the rash associated with Lyme isn't always a bullseye rash. There's a myriad of different looking rashes that can be Lyme-related. But again, when you see these kind of weird rashes that pop out of nowhere, and the big thing about the Lyme rash typically is it doesn't tend to be itchy or raised. So it's not like eczema or psoriasis or some of these other skin conditions. So when you see these red spots that usually tend to get pretty big, they're not raised, they're not itchy, they come out of nowhere, particularly in conjunction with these other symptoms, that would raise a red flag for me. The other thing that's very typical, at least for Lyme, is what we call migratory joint pain or wandering joint pain. When you talk about one day, it's your right shoulder, the next day it's your left knee, the next day it's your right ankle. When you start to see this joint pain move from one body part to another, again, as far as we know, there's no other condition that causes that other than Lyme. When it's rheumatoid arthritis or some other type of autoimmune disease, it tends to be the same joint all the time. So when you see it kind of move from body part to body part, that makes me very suspicious. And even just someone who's got this collection of sort of arthritic and neurological conditions, I think you have to investigate Lyme and these tick-borne illnesses, just because again that's a pretty narrow window of different things that can trigger both connective tissue and neurological symptoms. I mean, there are other things too, but when you look at other conditions that look like Lyme, I mean, it's chronic fatigue and fibromyalgia and MS and Alzheimer's and Parkinson's and Lou Gehrig's disease, and there's just so many different conditions that often get misdiagnosed. And I think it's something again that at least as a healthcare provider should definitely be on their radar. But as a patient, when you've got these mysterious symptoms that you've gone to the doctor, you've run numerous tests, and it keeps coming back negative. That by itself, if I hear that history, and I'll ask, have you ever been tested for any kind of tick-borne illness? And if they say no, well, that's the next thing on our list that we need to rule out. And I'll give you just a great example. I have a little girl I'm working with here in California who started out of the blue just getting headaches. She's 8 years old. So it's so odd to have a child to get headaches, persistent headaches, daily at that age. And she had an MRI, and it was basically normal. And she's been to an ENT, and she's been to a neurologist, and she's been to all these other doctors. And everything keeps coming up negative. And I said, well, you don't really have a lot of other symptoms, but, let's test you for Lyme disease. And I actually just got her report back yesterday, and she's even CDC positive for Lyme. So today we're going to have that conversation about treating Lyme. But here in a child, I mean, really her only presenting symptom was this daily kind of dull headache. So, any kind of persistent neurological condition should definitely raise a red flag for people.
So how does somebody go about getting tested as well? I mean, it would be hard with that myriad of symptoms. I mean, there's some diseases that we could look at and say, okay, we should be tested if you have that, but a mild headache, not everybody knows that. But then there's the testing. So what do you recommend people do to find out that they do have Lyme or to rule it out?
Yeah, unfortunately, I was a microbiologist before I was a doctor. I actually used to do these tests for a living, and Lyme testing is terrible at best, horrible at its worst. And, the standard two-tier testing that the CDC recommends, we know is not very sensitive, which means the likelihood of it picking up the disease that you're testing for is low. A good lab test actually will be at least 95% sensitive. What we know from the research is that the current testing is only about 43% sensitive. So really, it doesn't even pick up half the people that actually have the condition. And even then, that test is really only designed for people when they're in the acute phases of Lyme. So if someone got exposed years ago, the likelihood of that test being positive is pretty low. So what I do in my clinic is that, we don't use general reference labs for Lyme testing. They're just not reliable. So there are a handful of labs out there that do more sensitive testing, more specific Lyme testing. So we use labs like Medical Diagnostic Labs in New Jersey. We use IGeneX in Palo Alto, California. We use Global Lyme Diagnostics, which is a new lab that came out last year. And I'm very excited about this particular lab because they've isolated a sequence on the Borrelia organism that's common to all Borrelia. Unfortunately, the lab testing that's currently available really only looks at Borrelia burgdorferi, which is the first strain of Lyme that we identified in Connecticut back in, the early 80s. But we now know that there's upwards of 100 different strains of Borrelia in the United States alone. So the fact that the test is only looking at one of them, it's not difficult to consider that, we're missing a lot of other Lyme cases because we're looking at the wrong organism. So this new lab is now looking at a sequence that's common to all Borrelia. And I've run it in parallel with other labs, and even when other labs tend to come up negative, this one comes up positive. So this is now part of my routine workup for people where I'm worried about Lyme. I run this test usually in conjunction with either MDL or IGeneX that looks more at the antibody test. And then sometimes we'll use Armin Labs. They're based out of Germany, but they're a non-antibody test. So they're looking at cytokine activity, which is a sign of immune activation. So we use kind of a collection of different labs depending on where we think people are in their process, how long ago we think they were exposed. But people need to know that there are labs out there that can give you better information. At the end of the day, Lyme is a clinical diagnosis. It is based on your collection of symptoms. So you go through the process and you test for Lyme. If it comes back positive, great. We know that's what we're dealing with. If it comes back negative, unfortunately, it still doesn't exclude the possibility of having Lyme. But you also have to go through the process of ruling out other conditions. So we'll do other blood tests to rule out other autoimmune diseases, other types of infectious agents. I've got a whole battery of labs that we run routinely just to make sure it's not something else. Mold, for example, is one that commonly looks like Lyme disease. So if someone's had toxic mold exposure, that can make them feel very sick. So sometimes we have to rule out mold. So again, I talk about it more in the book, but there is a whole list of labs that people can run that will give you better information about what's going on.
Well, perfect. Thank you so much. We're going to take a quick break today. We're talking with Dr. Darin Ingels, and we're discussing his book, The Lyme Solution. We'll be back shortly.
The future of online TV is here. View exclusive content from your favorite talk radio hosts and new programs that you can't see anywhere else. Visit voiceamerica.tv today.
The Voice America Live Events channel is here now to showcase your corporate, individual, or organization's live event. Visit voiceamerica.com/live events to see all of our past live events and find out more. Whether it's a multi-day conference, special speaker, or single-day event, we've got everything to make your event a success. We can do a few hours or a few days. For more information about taking your event to the next level, call Jeff Spinard at 480-294-6417 or email info@voiceamerica.com. Again, that's Jeff Spinard at 480-294-6417 or send us an email to info@voiceamerica.com. Voice America is where you are and where you want to be. Join us around the globe as we broadcast live from some of the most interesting events available. Don't forget to view all our live events, including on-demand access to past events that you may have missed by visiting voiceamerica.com/live events.
Is email an important part of your business? It is for us. That's why Voice America partners with MailJet. MailJet lets us create impactful newsletters and deliver them right to the inbox fast. Microsoft, MIT, and Avis trust MailJet for their emailing, and so should you. Go to mailjet.com and use the promo code VoiceAmerica to start emailing for free today.
Find out what's happening on the Voice America Talk Radio Network by keeping up with us on Twitter. You can find us at Voice America TRN.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Dr. Darin Ingels. He is the author of The Lyme Solution. So, Dr. Ingels, we talked about how to recognize that you do have Lyme, and one thing you talk about in your book is that antibiotics don't always work. Can you just tell us a little bit about that? Because that's the first response that people go to, is I need antibiotics, and their doctors will scare them as well. But I mean, can you just explain what you're talking about in your book?
Sure. Well, I think, again, antibiotics definitely have a place. I mean, for someone who has acute Lyme disease, I prescribe and I recommend antibiotics. Again, I think there's good evidence that that's the appropriate treatment at the time. But most of the patients I'm working with, either they've been exposed to Lyme many years ago, or they've already gone down that pathway of having been on antibiotics and really did not improve. The counter side to the antibiotics is that, of course, they're going to wipe out a lot of your normal microbiome, and we just have so much research coming out about the importance of these beneficial gut microbes and how they modulate your immune system and do so many other, healthy things for our body. So the more that we eliminate those, the more difficult it's going to be for our immune system to do what we want to do. And I don't think that people realize that, your gut's responsible for upwards of 80% of your immune function. So if the gut's not functioning well, then the immune system inherently doesn't function well. So there's sort of this paradox that, the treatment you're doing to try and, clear the infection is sort of accidentally damaging your own body. And when you're on antibiotics long term, we know that it can actually start damaging your mitochondria. And the mitochondria, for people who don't know, are part of your cell that literally create energy. We know from the research that Lyme disease itself damages the mitochondria. Then you've got the antibiotics that pile on top of that and perhaps make that situation worse. So for people with Lyme who suffer from persistent fatigue, it's very, very difficult to get over that fatigue hump when you've got all these things, working against it. So, I think there's this misunderstanding that, herbs just aren't as strong as antibiotics. They just don't work well. And I would just say, well, these are people who really don't know herbs very well. That's not true at all. In fact, Dr. Eva Sappi at the University of New Haven, if you're familiar with her work, she's actually researched at least some of these herbs and actually found that they work better than doxycycline, where doxycycline only deals with Lyme when it's in its uncoiled form. We know that the herbs deal with Lyme in its three different forms. So whether it's uncoiled or balled up in its round body form, the herbs actually work very well. So you could argue, at least in a petri dish, that the herbs are more effective than the antibiotics. So I think, when you think about what plants do, they do so much more than just killing the organism. Plants as a whole tend to have a lot of different, chemical components to them that do various things. So they may be anti-inflammatory. They may help with circulation. They may help with, blood flow. They may help with, reducing inflammation. I mean, they just do so many different things that I don't think people realize that's part of what they're doing. We focus so much on just killing the bug, we kind of forget about all these other things that Lyme's doing to the body. And certainly for someone who's had persistent Lyme disease, I think there's pretty good evidence that, the infection really isn't the problem anymore. One of my contentions in my book is that, Lyme really becomes an autoimmune problem. And again, we have research to support that. So I think the reason so many people end up with persistent Lyme where the antibiotics really just aren't helping very much is at that point it's not about the bug. It's really about all the immune disruption that's happened as a result of the bug. So, when I realized that, Lyme was really an autoimmune problem and I started approaching it differently, that's why I started seeing a lot of these long-term Lyme patients really start to improve. So, antibiotics definitely have their place, but I think, certainly for chronic or persistent Lyme disease, for most people, they're probably going to be disappointed with the results.
Well, I'm glad you've brought up a lot of the topics that you have. As a doctor of Chinese medicine, I definitely agree with you about herbs. I find, they're all encompassing. So you have somebody that has this infection, but they also need some other support another way. And, you're giving them less to take and helping support their body while you're actually treating the infection, which most people appreciate when they're as sick as they are and they do need to take, more than one thing. thing. But there's also this component of, as you said, it's not always the Lyme that's causing the issue. There can be the autoimmune issue or other infections, or there can be mold. And those are things, of course, the antibiotics aren't going to cover. They're going to actually make those things worse if it's not treated properly.
Well, I'm always kind of amazed that, again, I've seen people who've been on antibiotics for months, years, who really aren't any better. And look, I'm all for anything that works. I said I've got nothing bad to say about any therapy out there if it's working well for you. I mean, at the end of the day, that's what's most important, is that you improve, you feel better, you get your life back. But, if you're doing any therapy, I mean, including antibiotics, and, you're not getting better, or like in my case, I was actually getting worse, where do you draw a line in the sand and say, hey, this really isn't the right approach. I really need to look at something different. But, what I'm seeing in the antibiotic world is that, we've moved to stronger and stronger and stronger, combinations of antibiotics. I mean, the current combination that a lot of ILATS doctors are using, I mean, we've pulled out, a drug that we used to use for leprosy. I mean, it's very toxic. You have to go in every week to get your blood drawn to make sure it's not damaging you. I've had one patient who was on continuous antibiotics for 12 years in a row. She was hospitalized 3 times because of the antibiotics. And, where do you say, enough's enough? I think we've had a handful of studies out there showing even after antibiotic therapy that Lyme persists. And, Dr. Horowitz talks a lot about these persister cells. And again, there's some good research showing that, there's this percentage of these Borrelia that are really very resistant to antibiotic therapy. And again, I think the concept of just having to kill the bug maybe falls a bit short. We don't even know that you ever get rid of the bug completely anyway. I mean, I'd be willing to bet if I tested everybody in New England, probably 80% of the people would show some evidence of exposure to Lyme, and then they don't all have Lyme disease. So, does this bug, kind of become part of your normal flora at some point? We don't really know because, culturing Lyme has been proved to be very difficult. The one lab that was available that did that is no longer in existence. So we're still depending on antibody responses to measure our exposure to Lyme, but without being able to measure it directly, it's really difficult to know whether we completely eradicate the organism or not. I'm of the opinion that I don't think we do. I've just seen so many patients that go, months, years of being symptom-free and then relapse, and particularly when they relapse at times of year where there aren't necessarily a lot of ticks out there, it just doesn't seem as likely that it's a new infection, that it's probably a relapse of an old infection. So I believe that Lyme is something that once you get exposed to is probably part of you for your life. It's kind of like, when you get chicken pox as a 5-year-old, you can get shingles as a 55-year-old. It's the same virus that stays in your body for 50 years. It just becomes opportunistic. And much like shingles, I think it's about keeping your immune system happy, feeding the terrain, making sure that the rest of your body's functioning well. And if you can keep, the rest of your body doing what you want to do and keep your immune system happy, I think that's what gets a lot of people feeling better. And again, I see people who, had Lyme and they've been doing well, and then they come across some very stressful event in their life, like, the death of a family member, a divorce, and that sets their symptoms off again. So I think we as practitioners, if we start trying to really do our job to get the body healthy, and that's really kind of what my book's about, is, that step-by-step process of, how do we help, fix the terrain so that it's optimized to, function at its best.
So one of the things you talk about in your book about getting healthy, it's actually one of the first things you go into, is your gut. So how important is that in this journey?
Well, it's critical, and as I mentioned, the gut's responsible for so many different things. Of course, digestion, absorption of your nutrients, which drives everything in your body, is the first part. But that effect of the microbes in your immune system is critical. And, we've just seen so much research really in the last decade coming out about the importance of your microbiome. And I mean, not just with the immune system, but for mood and weight and, all these other processes is driven by, your balance of gut microbes. So, we know from animal studies, when you give a rat one dose of antibiotics, I mean, that's one dose, not one day, one dose. It takes 6 months to repopulate its gut back to normal. So what happens when we've been on antibiotics for, weeks to months? And I think realistically, it takes a very long time to get our gut back to where it should be. And so many people, they start to repopulate their gut, and then, they get a sinus infection, go on another round of antibiotics, and, it's very common in modern society that people get courses of antibiotics intermittently over the course of years that constantly disrupts the gut and ultimately the immune system. So, what that first part of the plan is really about is, how do we repair the gut? How do we fix it? I think we as practitioners see so many people with what we call leaky gut. The gut just allows too many large proteins to pass through, which are very immunogenic, and they stimulate your immune system in a negative way. And so a lot of people I see with chronic Lyme, they've got food allergies, they've got chronic constipation and diarrhea and gas and bloating, and again, sort of this litany of, gastrointestinal symptoms. So it's really about using herbs and nutrients to help repair the gut, rebuild the microbes, and, start functioning better again.
So, obviously there would be some probiotics involved. Is there a diet that you recommend people follow through as well?
Yeah, that's really the second part of the plan. And, having done various diets over the years with patients, what I found seems to be sustainable for people. A lot of diets, because of their difficulty, people sometimes just have a hard time sticking with it. So what I recommend is what's called an alkaline diet. And an alkaline diet is kind of a hybrid of paleo diet. And what happens in the paleo diet is that people tend to eat a very low carbohydrate, high protein diet. But in the paleo diet, the protein intake tends to be pretty large for most people anyway. So what an alkaline diet suggests is that you're still eating a mostly plant-based diet, but we try and limit animal protein to about 80% of your dietary intake for the week or less. So it kind of goes back to, I think, our true hunter-gatherer days where, we didn't kill every day. We killed when we could. So animal protein was not the bulk of our diet. And I think this kind of speaks a little bit closer to that. And then I have some foods that we just know are very acid-forming in the body. So the basis of an alkaline diet really is that we're trying to have you eat foods that make your body more alkaline. And the reason is that physiologically, your cells function best in an alkaline state, with the exception of your stomach, your bladder, and for women, the vaginal area, which is very acidic to help protect against outside invaders. The rest of your body is actually very alkaline. So the whole purpose of this diet is to really promote better alkalinity in the body. So there are some foods that are very acid-forming, so things like, dairy products, processed foods and junk foods, a lot of sugary foods, coffee, all tend to be very acid-forming. So these are foods that said, look, they're very acid-forming. Let's eliminate them from your diet completely. But again, I find this is a diet that people can actually follow. They don't feel deprived on. They still have a lot of different foods they can eat and like to eat. And again, even for animal protein, for people who are big meat eaters, it's not that you can't have it. It just doesn't become the bulk of every single meal. So again, I find it's something that people can sustain, they can follow long term, and it really does become part of your lifestyle. This is not really designed just to be something you follow for a month and that's it. You really start shifting the way you eat, and the end product of acid formation really is inflammation. So at the end of the day, it's really an anti-inflammatory diet.
Well, I mean, definitely that's something that we want when we're suffering as much as people do with Lyme, is to bring the inflammation down in any way. And, I find if people aren't willing to change their diet, I don't know at the end of their treatment if I've missed something or if it's because they're just not following through and they're recreating that inflammation all the time.
Right. Well, I know, from my own personal experience, I was a big coffee drinker. I love coffee. And I would find when I was in the throes of Lyme that, even a sip of coffee, my neuropathy would flare within minutes. And, I tested it over and over, and every time I have coffee, neuropathy gets worse. So, I had to go have coffee for years. I'm now at a point where I can have it occasionally, and it doesn't seem to bother me. But I think when people are first starting off, and especially if they're not feeling well, you really want to be diligent with this to get the best results.
Well, thank you for sharing that. So when people have a lot of inflammation as well, this is very common with the Lyme, what do you recommend that they do?
Well, for inflammation related to Lyme, of course, treating the infection itself. I mean, I think there is benefit of treating the organism because, the way I think of it is that, if there's a million organisms in your body, that's going to stimulate a certain immune response. And if we can get that down to 100 organisms, there's less stuff to stimulate the immune system. So I think for people, who've even been on antibiotics and say, look, I feel well when I'm on antibiotics, and when I come off, I feel worse again. I think a lot of that is really just about reducing the load of organism in the body. So again, I think this is where herbs come in that can be very beneficial, both again at treating the organism, and we have a lot of herbs that have anti-inflammatory effects. Curcumin's probably one herb that has the most research. They've compared it to drugs like Vioxx and Celebrex, which are common anti-inflammatories that are prescribed. It works as well or better without the side effects. It doesn't tear up your stomach and cause other gastrointestinal problems. We've got herbs like boswellia. We've got herbs like white willow bark. And, of course, in Chinese medicine, I'm not a Chinese herbalist, so you can speak to that much better than I. But, we've got a lot of herbs in our repertoire there that we can use to help reduce inflammation. So it's really just a function of, starting one of these herbal protocols and, seeing how you respond. But I've had really good success on getting inflammation down by using herbal medicines. I find cat's claw also is another great herb for reducing inflammation. I mean, even before I really knew about Lyme disease, I would use cat's claw for back pain. I sit at a desk all day and my back would bother me, and I would just take some cat's claw. We've now learned that cat's claw is a great anti-Lyme herb. But it's also very potent anti-inflammatory. So again, we got a lot of very good things that we can use that just don't disrupt your gut.
Oh, perfect. We're going to take a quick break. We're talking today with Dr. Darin Ingels, and we're discussing his book, The Lyme Solution. We'll be back shortly.
The future of online TV is here. View exclusive content from your favorite talk radio hosts and new programs that you can't see anywhere else. Visit voiceamerica.tv today.
The Voice America Live Events channel is here now to showcase your corporate, individual, or organization's live event. Visit voiceamerica.com/live events to see all of our past live events and find out more. Whether it's a multi-day conference, special speaker, or single-day event, we've got everything to make your event a success. We can do a few hours or a few days. For more information about taking your event to the next level, call Jeff Spinard at 480-294-6417 or email info@voiceamerica.com. Again, that's Jeff Spinard at 480-294-6417 or send us an email to info@voiceamerica.com. Voice America is where you are and where you want to be. Join us around the globe as we broadcast live from some of the most interesting events available. Don't forget to view all our live events, including on-demand access to past events that you may have missed by visiting voiceamerica.com/live events.
Is email an important part of your business? It is for us. That's why Voice America partners with MailJet. MailJet lets us create impactful newsletters and deliver them right to the inbox fast. Microsoft, MIT, and Avis trust MailJet for their emailing, and so should you. Go to mailjet.com and use the promo code VoiceAmerica to start emailing for free today.
Find out what's happening on the Voice America Talk Radio Network by keeping up with us on Twitter. You can find us at Voice America TRN.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Dr. Darin Ingels. He is the author of the Lyme Solution. So, Dr. Ingels, one thing that is very common with Lyme, which I think is important to talk about, is herxing. This is, although a technical term, Herxheimer, used a lot, mostly in the Lyme world. Can you just explain to us what that is and what that means for people who are doing treatment?
Sure. Well, herxing is a very common, so, technically it's the Jerash-Herxheimer reaction, obviously named after the two doctors who discovered it. And what it is it's the effect of, it's really a die-off reaction by treating Lyme, and it happens with other organisms as well. And it's really a combination of two things. It's the release of a lot of these endotoxins from the organism itself, but it's also the immune activity against the organism, particularly these group of immune molecules called cytokines. So the combination of the two produces basically flu-like symptoms. So you can feel more tired and a headache and achy and sore and just kind of, blah. So, when people start undergoing Lyme treatment, whether it's antibiotics or herbs, it can happen with both. People often experience this reaction. And it's interesting, I've heard from other doctors that, you have to get this reaction to know that your treatment's working. I can tell you personally, I never got a Herx reaction when I went through any therapy, ever. So I don't believe you have to get this Herx reaction to know that your therapy is working well. If you start to improve clinically and you get less joint pain and your energy is better and everything like that, it's working. So if you experience it, don't panic. It's not uncommon. But if you don't experience it either, don't panic either. It doesn't mean that your treatment's not working. It's just, it varies quite a bit from person to person and how their body reacts to the treatment. But for people who do experience the reaction, again, fortunately, there's quite a few things we can do to help mitigate that. One of my favorite therapies, and it kind of comes out of my work as an environmental medicine doctor, because we use it for other people who get allergic reactions, is we start alkalizing the body. And there's a few ways that you can do it. There's a product called Alka-Seltzer Gold that you can buy usually at most pharmacies. It's different than Alka-Seltzer that people use for indigestion. But Alka-Seltzer Gold is a bicarbonate formula. And bicarbonate actually helps reduce a lot of these Herx reactions. So Alka-Seltzer Gold works great. There's another product we use called Trisalts. And there's several companies that make Trisalts. But Trisalts is a combination of sodium, potassium, and calcium bicarbonate. And again, that bicarbonate, starts to change your body pH. And in doing that, it starts to shut down a lot of that Herx reaction. So people can take these treatments, every hour or two when they're in the throes of it to really kind of help blunt the reaction. And that works well. Again, we've also go back to herbs, and so there's a herb called berber that we use a lot of. It's a liquid tincture that can help block a lot of that Herx reaction. In the Chinese herbal formulas, Dr. Zhang has a great formula called AI number 3. I've used a lot of that to help stop a lot of the Herx reactions. And of course, you can use a lot of your anti-inflammatories like curcumin and boswellia. But I think I've had the best success with using the alkalizing agents and berber.
Thank you for sharing that. For my Canadian listeners, the Alka-Seltzer Gold isn't available in Canada, but definitely available in the States for anybody who wants to try that when they have issues. I was the opposite of you. Everything I did, I herxed on, and when I started treatment, I wasn't warned about it, that was not very nice because I thought I only needed a month of antibiotics to deal with, over 14 years of illness, and I was thrown into 3 antibiotics and realized this was years that I needed to go into treatment. So then I took a different approach, and I was so happy to read in your book that you talked about all the herbs basically that are dear to my heart as well. The Cowden Protocol, I believe, saved my life. I actually interviewed him last year, I think it was, I think a lot of people in the Lyme world are familiar with some of that, but I'm so glad that there's a place where, like in your book, where people can find, that all put together, because at that time it was all over the place, and I just read this little snippet, and then I had to go and find that on my own.
Yeah, well, for your Canadian listeners, with Alka-Seltzer Gold, trisalts might be a bit harder to find. The cheap, easy way is baking soda. You can find baking soda everywhere. It's sodium bicarbonate, which I don't think works as well as potassium bicarbonate. So that's really the key ingredient in Alka-Seltzer Gold is potassium bicarbonate. But again, you can find Arm & Hammer baking soda everywhere, and it doesn't taste very good. But again, if you're really herxing and you feel terrible, you can probably pop down to your local grocery store, pick up some Arm & Hammer baking soda, and, for most adults, half a teaspoon every hour or two often will help, again, block a lot of that reaction.
Well, perfect. So can you just explain, just about some of the herbs that you talk about in your book, and how people would get started onto a program?
Sure. Well, there's so many different herbal protocols out there, and again, what I find is that, everyone kind of has a different experience with each protocol. From my personal experience, and again, in the patients I've treated, there's two protocols I really kind of highlight in my book. The first one was developed by Dr. Zhang, and again, he's the doctor I saw in New York City, and his are Chinese herbal formulas. And I'm sure your listeners are aware, in Chinese medicine, herbs are really never used singly like we do in Western medicine, where we'll use one herb by itself. Chinese herbs are always formulas, and those formulas are developed in a way to help balance each other for various reasons. So I find the least herx reactions with Dr. Zhang's formulas. I rarely see it in patients. Again, I never personally experienced it. So Dr. Zhang's formulas, again, I like because they encompass, I think, the broadest scope of what Lyme does to the body. So there's primarily 5 or 6 formulas that I use, and again, they help kill the organism. And the other thing, too, is, we've talked so much about Lyme, but we haven't talked about co-infection, but I like the herbs because the herbs really address pretty much all the co-infections as well. So whether you have Bartonella, Babesia, Anaplasma, Ehrlichia, Rickettsia, the herbs seem to address all of them. So we really are kind of killing, more than 2 birds with one stone. So his formulas address the organisms. They're anti-inflammatory. There's a formula to improve circulation. There's another one to help to boost the immune system. So again, I find that combination actually works really well. I've also used a modified version of Dr. Cowden's protocol. Dr. Cowden's protocol, every month you keep changing the herbs, and it's a bit labor-intensive and kind of expensive. So Dr. Sappy's work, again, she really looked at just a few of those formulas. And I've just found clinically that I just use 4 of his formulas. I use Cemento, Banderol, Kumanda, and Berber. And again, I find for a lot of people that combination actually works really well without having to get into the whole protocol. It's just cheaper, easier, and again, clinically, I think, those are the herbs that are doing a lot of the heavy lifting in the protocol. Beyond that, Byron White, who's an herbalist, has, specific herbs depending on what infection you're treating. Susan McCamish at Beyond Balance has, various herbs. Again, there's not really a protocol, but there are herbs to address each of the different, Lyme and co-infections. Of course, Stephen Buhner has his protocol of addressing Lyme, and again, I think it encompasses a lot of what Lyme does to the body. So, it's really a function of what works best. My approach is that you start an herbal protocol, whatever it is, and, give it 6 to 8 weeks to really give it a fair shake. And depending on how you feel at the end of that time, if you feel like you're improving and things are better, it's probably worth continuing. If you don't feel any difference whatsoever, at that point it's probably worth trying something different. And again, my experience has been that some people just do well with one protocol over another for no real logical reason. But I'm also not in favor of, staying on the same protocol for months and months and months, seeing no improvement at all. That's just kind of a waste of time and money. So you should see some element of improvement. Now, sometimes that improvement is fairly nominal, but at least it tells you in the right direction. You're heading in the right direction. And again, during that time, we're usually also looking at all these other outside influencers that might be impacting your health, again, like diet and so forth. So, my book, again, outlines each of the different protocols. And if people are really interested and they can't find it, we have an online store. People are welcome to visit our website, and we do ship internationally. So if people are having a hard time finding it, they can read the book about the protocols, and then we have it available online.
Well, I want to talk, in your book, you talk a little bit about some of the other things that can be a factor. I believe we shouldn't have Lyme blinders. Lyme is the only thing causing your symptoms. And, sometimes patients come in, they're like, well, I have this symptom, but that's the Lyme. I have this, but that's the Lyme. And it's important to actually step back from that thought sometimes and say, okay, but is there something else going on here that's missing? Like you mentioned before, is there mold toxicity that's actually creating all these symptoms and you just feel sick in your house and that's why you're not getting better? And you talk a lot about this in your book. So can you just tell us some of the more common issues that you do see?
Sure. Well, I think there's a saying that if you're a hammer, everything looks like a nail. So I think for a lot of Lyme practitioners, it's very easy to see everything through Lyme glasses. And you're right, you have to be able to be objective and stand back. And particularly if someone's already been on Lyme treatment and they haven't really responded very well, that would sort of, make me think that perhaps something else is going on. So mold, as I mentioned, is really probably the top thing that looks like Lyme the most. And it can be either mycotoxicity or mold allergy. There are actually two different issues related to mold, but both of those usually need to be investigated. The other one that comes up a lot is SIBO, small intestine bacterial overgrowth. I've had several patients now that have Lyme-like symptoms, particularly neuropathy, that, again, didn't really get better with Lyme treatment, and we tested them. There's a breath test that's available for SIBO to rule that out. And once we did SIBO treatment, her neuropathy, completely got better. So that's one that, again, that can look like it. And again, even just looking at all these other autoimmune-related problems, once in a while we do find that there is some other type of autoimmune process going on that's really completely unrelated to Lyme. And even, gut microbes. I've seen this in a handful of patients that had Lyme-like symptoms, and we found that they had an overgrowth of something like Klebsiella in their gut. Well, a lot of these other microbes can trigger a similar process. So again, it's not unique to Lyme to create autoimmunity. And when you go into the medical research, we'll find that there's a ton of microbes. So sometimes it's really just looking at other microbes, and perhaps it needs a different treatment based on that microbe. So that's where, for me, stool testing becomes very important, because it can help identify if there's any kind of overgrowth of yeast, overgrowth of other bacteria, because all of those can mimic Lyme as well.
Well, yeah, thank you for sharing that. I think that's important to bring up all the other things that can happen. I always have to remind people, you're a human being and you're not Lyme. So we have to look at the big picture of what's going on. What's your lifestyle? What's your house like? And what else is going on that may be taking advantage of your weak immune system with the Lyme, but that there is more than just Lyme and the co-infections that come with it. There's a bigger picture here.
Absolutely. Well, I think we all approach it from a whole person approach. We're looking from top to bottom, all these other external factors. And again, I think that's just really important when you're dealing not just with Lyme, but any chronic illness, that you really are taking a full evaluation of all these other, again, external factors that might be influencing your health and certainly your immune system.
Oh, thank you so much. Now, if anybody has any questions, is there any way they can get a hold of you or find your book?
Sure. Well, the book's available through pretty much every major bookstore, retailer, online, Amazon. I'll carry it. Otherwise, they can contact me at my website, which is dariningelsnd.com. That's DARININGELSND.com. And we've got a lot of information about Lyme disease. We have a store if people are interested. We'd love people to follow us, and again, we're really about trying to educate people about Lyme disease, and I certainly want people to get better.
Well, thank you so much for joining me today. This was a great show.
Great. Thanks, Rebecca.
I want to thank everybody for listening today. May is Lyme Awareness Month, and it is also when ticks are the most active. So please be sure that you know how to protect yourself and your family so you don't have to go through the process that Darin and I talked about today. Thank you so much for listening. We're talking with Dr. Darin Ingels, and we're discussing his book, The Lyme Solution. Just be sure to make today a great day.
Thank you for tuning in to this week's edition of Falling Through the Cracks. feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness channel. We'll talk more next week.